Good morning, afternoon. What are we? I'm like, I don't even know what time it is. It's such a crazy day. How are you?
We're good. Julia, how are you?
I'm very good. Sorry for my delay. I was just on the phone with the governor's office talking about homelessness in New Jersey. I said, I gotta go. Gotta talk with some other folks about this. So
You gotta talk to these characters from Kansas for a while.
are you kidding?
Yeah.
I love meeting new friends. How are things in Kansas?
Well, it's a beautiful day, Julia, in Kansas. Unseasonably warm right
Wow.
now, and the sun is shining. And but that said, we're all happy to come inside and and uh, and 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 take some time to visit with you and to learn from you. So,
Sure. Well,
uh,
it's snowing here, so I'm glad to be inside.
okay, well you just keep that snow right there, young lady. Okay,
Okay.
Julia, my name is John. By the way, John Crable,
Nice.
and this group is part of what we call Justice Matters here in Lawrence, Kansas. We are a faith-based advocacy group, so we're not a direct service organization. So we can't actually do things uh, per se,
Okay.
but our role is to influence decisions, if you will.
Sure.
So, Justice Matters, one of the three initiatives that Justice Matters is working on right now here in Lawrence, Kansas, Julia, is homelessness.
Okay.
Now, we're addressing homelessness in general. We have not yet gotten to the point where have broken it out into chronic homelessness and veterans homelessness and youth homelessness and down those lines. We're just addressing homelessness as a whole. This is our second year for Justice Matters to take the initiative of homelessness on. So we've learned quite a little bit through all of our committee work last year. This is actually, Julia, this is our first committee meeting.
Wow.
Yeah, for this year. So, and we wanted to get the most important person,
Oh my gosh.
the absolute most important person that we could think of
Wow.
to help us kickstart our initiative for
Can you
this
say that
year.
again? And I'm going to have my husband hear that and my kids
Okay,
ignore
you
me.
bring him in,
They're like,
Julia.
blah, blah, blah. Mom's talking. Go ahead.
Yeah, yeah. So we're just absolutely thrilled that you have agreed. I don't know if you can tell, but there's 19 of us
Oh my gosh.
on. Yeah,
Not.
there's 19 of us. However,
Yeah.
you're only going to hear from me.
Uh-oh.
Okay.
Oh,
So I'm the spokesperson of the crowd. The rest of the group are going to be incredibly interested in hearing what you have to share with us,
okay.
from what you've done there and what your organization has done there with your leadership. So we understand that in 2016, Bergen County became the first county in the United States of America to literally reach functional zero for both chronic and eventually veteran homelessness.
Correct.
Let's just kick the conversation off with
Right there.
how in the heck did you how'd
I
you
have to
do
tell
that?
you, even when you say it, I still get goosebumps. Like it never is lost on me, that accomplishment. So it's so nice to hear you say it. And when you say it like that, it just makes me feel like really wonderful. Um, so one of the wonderful things about my job is I get to talk about the work of a lot of other people. When I'm talking, I want to just make sure that everybody just keeps that in mind. Um, so usually I do a PowerPoint presentation and I kind of take you through the origins of our work. So I'm going to try to do it as succinctly as I can without visual aids. So pretty much Bergen County was very much like most places, which is we had 4 temporary shelters, and our faith-based organizations and government institutions were doing their best that they could to address homelessness. But homelessness was going up, and chronic homelessness specifically was going up. So HUD happened to require any of the communities, the COCs that were getting money, to do a 10-year plan to end homelessness. So the County of Bergen used this time to actually do a stakeholder inquiry. They hired a consultant. The consultant came in and interviewed 200 stakeholders and said, if we were going to change our homeless system, if we were going to redo things, what do you think we should do? And documented all of that input into a document. And at the same time, was also looking at best practices around the country that were working to end homelessness. The number one being this model of housing first. So the county now has this document that says, these are some of the things that our folks in our community were talking about. We need one shelter. We don't want multiple places to bring people. We want one place to bring people. We want something to be open 24 hours a day. We want to have one place that you can get food and get services. We want all those things kind of co-located because we're in the suburbs. Not everybody has cars. Our transportation is not like it is in a city, in a large city. And they also wanted to make sure that people could get access to housing, that it wasn't just enough to shelter people, but also get access to housing. So using this model, and then also looking at housing first, what the county decided to do was in their 10-year plan was to have one big facility, one brand new facility, and that this facility was going to now become the one stop for homelessness. And they built a 27,000 square foot building, which is the shelter. It also has a feeding program. It has multiple flex office spaces located in this building. And the design was really that everything addressing homelessness was going to happen in this one place. So they did build this facility. We opened it October 1st, 2009. I was hired as the director. And what we did was we closed down those other 4 shelters. So those other 4 shelters were no longer in existence. And one of the shelters, actually the most successful shelter, was within a church. So what ended up happening is now the church doesn't have to have homeless people sleeping in it at night. It can go back to being a church. But what the county did was they did RFPs. They did a shared service agreement, which I'll talk about in a second, which is with my agency. But they did 2 RFPs. And the RFP for the shelter operations and the drop-in center was awarded to the church that was the shelter. So even though the church now no longer has it at the church, but they're now managing this work with us in the building. So the other RFP went to a mental health organization, which does case management. The key partner agency that a shared services was done with the County of Bergen was the Housing Authority of Bergen County, which is really a brilliant stroke of genius to have the Housing Authority at the helm of this work, because think about it, the Housing Authority has housing, right? So the Housing Authority hires me. I have a background in supportive housing for 20 years in New York City. I worked with very seriously mentally ill. I worked with Bedford Hills Correctional and Sing Sing. I did housing, permanent supportive housing, worked with people with co-occurring disorders for over 20 years. And I live in Bergen County, so this is actually my home. So the Housing Authority now is at the helm in terms of the management of this facility. You have Christchurch Community Development Corporation They're managing the shelter operations, and you have Care Plus New Jersey who are doing the case management. So basically, what the county does is they build the facility, but they don't have any of their folks working in the facility. They put the experts in the facility who actually know how to do this work, but they do it as a collaborative. So we're all working together, but we all work for different organizations. So my job is to keep everybody having fidelity to their contracts and fidelity to a housing first model, but also working well together. And then what we do is in the facility, we have offices that are flex office spaces where the other partner agencies can come in and do what they do. So for example, the Board of Social Services that does our welfare, our food stamps, all of that, they have an office 3 days a week in the facility. So our folks don't have to go up to their office, which is chaotic in any place. I don't care where you are. It's chaotic. It's difficult to maneuver. And now their folks are with us. So right in the shelter, in the center, they can take a application for food stamps. They can take an application for general assistance. And we can have the documents that people need right on site. It's really fabulous. We also have people who do our outreach to the homeless. They have office space when they need it. We have our HIV program was located on the property. So the idea is that when you open up a facility like this, the first thing that happens is everyone gets very nervous because they think you're going to put them out of business. So it's very important that if you do this kind of model, people understand that the county's not going to do what you're doing. The county just wants you to do what you're doing here. And they're going to give you free office space to do it, and copiers and printers and whatever else you need, and a phone. But we're just going to ask that you do it here. Because the idea that homeless people are going to leave the center and go transversing through the city of Hackensack is the reason people don't like homeless people. They don't want them transversing through the community. They don't want to see the shopping carts and the dirty clothes and them talking to themselves. So what we've created is all the services they need are here at one place, plus food and clothing and showers and phones and medical care. And we've put it all in place in one facility. So through this facility, we also have access to housing. So the Housing Authority does do set-asides. We do have set-asides, and they do make our homeless individuals priorities for housing. We have a by name list. We have a coordinated assessment. We have a housing prioritization list. Everybody gets scores. Everybody gets numbers. So really, if you create something where you're taking people off the street as a priority, you're taking your sickest folks with mental illness, with drug abuse, with criminal histories, right? All of that. And not only are you taking them, but they're your priority. And you're a low barrier shelter, and you're taking them into your program. And then you're focused on housing them, putting them into housing, even if they're not taking medication, even if they're still drinking, even if there's still things going on, we're still housing them. So we focused on our most chronic folks through this building. And because the building was new and it was clean and it was safe, we have security there 24 hours a day. It's safe. People will come off the street and stay there because they weren't afraid, because it was clean, because their stuff wasn't stolen. We let them bring their personal belongings in. Everybody has like 2 bins to put their things in. So your first thing is, can you get people off the street? Will they stay with you in shelter? Will you prioritize them? Secondly, are you getting their documents recovered? Are you getting them IDs? Are you getting them the basic things? Are you getting them welfare and food stamps? Are you getting them those things as quickly as possible? And then getting them into housing. So basically for us, housing ready means you have an ID. That's housing ready. It doesn't mean you're not drinking. It doesn't mean your mental illness is gone. It just means that you could sign a lease today. That's what that means. So we work very hard to get people housing ready, and that's the role of Christ Church through the drop-in center. So we have a drop-in center every day, twice a day, 365 days of the year in the facility. So if you think about it, what it looks like is you get up in the morning, you have breakfast, then we have our drop-in program. We have coffee. You can go see the person from the Board of Social Services. You can meet with a PATH person. You can meet with a mental health case manager. Then you have lunch on the property, and there's no cost for any of this. Then after lunch, we have our drop-in program again. And now this is run by Christchurch Community Development Corporation using a, the name of it just escaped me, radical hospitality. It's a radical hospitality approach. And so we call our folks guests. We don't call them clients. We don't call them residents. And I love guests because it connotates that there's a way to treat people like they're guests. It also means you don't live here. It also means you're only staying for a little while. Guests is like if we all went to the Marriott, right? We're guests of the Marriott, but the Marriott will slip something under your door that you know you're checking out. We do the same thing. When you come in, we tell you you're going to leave in 90 days or less. And these are the things that you have to do in order to be ready to leave. And so right from the beginning, we're discussing discharge. And our focus with our folks in shelter is about housing. It's all we talk about is housing, because we have a number of people that would be more than happy to live there for the rest of their lives and never leave, because there's no cost to stay at the shelter. You don't have to pay to stay there. You don't have to have your benefits in place to stay at the shelter. You have to get them to continue to stay at the shelter. So we focus very heavily on making sure people go to housing. But I think another thing that's really important about what we do is that if I house you, you can come back for lunch or dinner every day if you wanted to. So we remain a touchstone for people. We can still provide food to people if they're living in the community. People do that. They do move and then they come back and they just have meals with us. But what's great about that is we can kind of look at people and be like, I don't know, they look a little thin, or they're asking for a shower. Why are they asking for a shower? They have an apartment. What's going on in your apartment? Is your utility shut? Like, so we can intervene much farther, upstream before people get in real trouble and they've been evicted. So that's wonderful about it is that we have all these services on site, including prevention dollars. So we can actually have a family come in and we can provide them with rapid rehousing. We can do security deposits. We can do first 3 months rent to get people back on their feet without even being in shelter. So we can do diversion, we can do rapid rehousing. And so we joined Community Solutions when it was a 100,000 homes campaign in about 2011. And the reason I joined them was because I just knew instinctively that what we had was magnificent. I was like, this works. What we're doing here is how you end homelessness. Because what we were doing was we were not managing homelessness anymore. We were ending it. And that's a very, very big shift. And even the way that we treated outside people coming in, where people would come and show up at the shelter and they'd have like potato salad that was in their cars for 16 hours and in the heat and the sun, and they'd want to drop it off. And I was like, you know what, this is old school. We don't do this anymore. We feed our people. I don't need the potato salad. I'm like, you want to bring it to the firehouse, or I in fact wouldn't bring anything that was in the car for 16 hours. But my point is this: there is a traditional way that people want to help the homeless, and that way doesn't work. It's getting people to think very, very differently about how we interact with the homeless. Also working with the police. When we first started working with the police would just kick people out of their car at the front of the center and have them walk up. And I started calling the police precincts like, what is that? What is that? Like, no. You have to come in the building. You have to tell us where you found the person. You have to tell us what happened. We have to determine whether or not they have to go to the hospital. Like, this old way of interfacing with the homeless had to stop. So I created a whole thing called the Hackensack Collaborative Outreach. It's a meeting that I do every 3 months. For 11 years, I've done this meeting every 3 months, with law enforcement, local leaders, city council members, the mayor's office, also advocates, the business district, the library, and we get together every 3 months to talk about what are you seeing locally? Are you seeing an uptick in the squeegee? We haven't had a squeegee guy in 8 years. I got rid of the squeegee guys. I mean, that was no small feat, but basically, you know, we stopped enabling that kind of behavior by basically saying, hey, listen, if you need something, you come down by us. You need a meal, stop going and begging at the restaurants. We're going to give you a free meal. So I worked with the restaurant owners to get people to come down by us. So this took years of changing this culture of the way that people were interfacing with the homeless. So now they're part of everything we do, where people will call me, I want to donate something, or I want to volunteer. And let me just leave you on this last kind of visual idea of how we changed, and then you can ask me some questions. About 4 years ago, maybe a little bit longer, I got a call from a local priest one afternoon. And he said, Julia, I want to go out tonight, I want to go out and I want to give out blankets to the homeless. So could you please tell me where I could find them? And I said, no. He was like, excuse me? And I said, no. I said, why would I want you to go out to the homeless and give them blankets? I have a homeless shelter. I said, I'll tell you what though, if you find a homeless person tonight, I guarantee you, I will put them in a bed. I guarantee you. So he went out and he found a veteran. He found a homeless veteran sleeping outside. And he brought him to the shelter that night and we kept him in the shelter. And the next day I called the pastor up and I said, I want you to come see me today. And he did. And I said, I want you on my committee. He's like, you want me on your committee? I don't know anything about homelessness. I go, you know everything you need to know about homelessness because you were willing to trust me. You were willing to do things a little bit different. And you had the connection to this person that brought him in that maybe we're not able to do that. Otherwise he would have been in already. And so I started to develop these relationships with people in the community about stop doing this old way, do it this way, but you get to be part of it with us, that we together as a community can end homelessness together. And when we did get to functional zero, which is a surreal, unreal experience, all those people were at our press conferences and continue to be our partners in this work. So John, of what I've shared, is there anything you want me to expand on or clarify, or do you have some questions?
Well, I do have some questions, Julia, but my personal desire would be for you to just keep talking and us to just keep listening, because this is fascinating to say the least. One of the questions that we do have, you mentioned early on, Julia, by name list.
Yeah.
Would like to know, we think that's pretty important.
Yeah.
We haven't got there yet, but we think that's pretty important. We keep hearing with Built for Zero that it's a real starting point to the whole process. How would you say the development of your by name list has played a role in your success? And a second component to that question is, with what frequency is that list updated?
Okay. So let me tell you a little bit about how we first started doing by name lists. People make lists. Lists are good. And you're people that are the providers, because I know you guys are not the direct providers, but with direct providers, they may have multiple lists. Like, so for example, in the beginning, we would have lists of like, who are the priorities for us? Like at that time, I have like who's over 60 list. I have who's under 21 lists. I had lists of who had certain medical conditions. So we all have these lists. And in the beginning, all of our folks that we knew who were homeless, whether they were in shelter or not, were on a list. So that's your by name list. Everybody homeless is on your by name list. So that's the origins. That's really all it is to begin with, right? But then what started to happen is we started to get full. We would only have like, let's say we had one bed left and I had two people at night who needed the bed. Now, traditional shelter is whoever gets there first gets the bed. And that's a terrible way to decide who gets anything. It's just, you guys are, it's in your name, justice matters, right? Social justice is not that. Social justice is not who got there first. Social justice is who needs it more. So the way that we would answer that question is the woman who's the executive director for Christchurch Community Development Corporation would call me up and say, Julia, we have two guys tonight and we have one bed. Who are we taking? And I would say, Mary, who's going to die tonight if they don't get in? And she'd say, this one. And I go, that's who we're taking. That's an easy decision for me. That's who we're taking. And so when we started working with Community Solutions, they started to talk to us about vulnerability. That's what vulnerability means. What that means is my guy that I picked would have a higher number than the other guy. And maybe because the other guy could stay in his friend's apartment for one more night, where the guy I chose was literally on the street. So vulnerability is how you design your by name list. So vulnerability is a score that's assigned through something called the VI SPDAT. And I don't know how much you guys know about a VI SPDAT. Now, it doesn't have to be the VI SPDAT. It can be another tool, but most organizations, most communities use some kind of assessment tool that assigns a number to people. So for example, you get high numbers for chronic homelessness. Your chronic homeless people should always be at the top of your list because they have the highest number. So chronic homelessness means that you've been homeless more than a year, or you've had, 3 episodes of homelessness in 4 years, whatever. They keep changing it. I can't keep up. But anyway, you have your chronic homelessness has the largest number. Domestic violence, very high number. People over 55, high number. People under 21, high number. People with physical disabilities, mental illness, substance use, all of those have a score. So if you're a person that has like 4 of those things, your number could be very high up there, like 14. Like the numbers aren't like in the hundreds, but they're like maybe 12. Like right now in my community, the highest numbers we have go up to like 8, maybe, because we don't have chronic homeless people anymore. So my domestic violence people tend to be the higher number, like domestic violence families. So that vulnerability is how you determine who you're most vulnerable. Now, it gets a little tricky. So when you say, what did that play as a role in our success? As long as you're housing the people at the top with the highest numbers, you're going to be able to move towards ending chronic homelessness. Not all homelessness, but chronic homelessness, because you're taking those top numbers. But it also means that you're matching those people at the top with permanent supportive housing, the most expensive, the most care intensive housing. That is social justice. The people who need the most get the most. That's what your by name list is supposed to do. Now, some people say, well, what happens to everybody on the bottom? They don't get any help? Well, what you do is that the people on the bottom or the people in the meaty middle get different things. So for example, I maybe have a number of Section 8s I can give out in a month. Who am I going to give them to? I'm not going to give them to the people at the top. There's no services with those. That person's going to be homeless again in 2 months. What I do is I look at my by name list of who really needs affordable housing. Section 8 is affordable housing, no services. You know who those people are in my community? They're my senior citizens who are on a fixed income with no chance of increasing that income, who are not very disabled, who don't have alcohol and drugs and all that other stuff. They just really kind of need more affordable housing. The housing lists are too long for senior housing. I may give that person a Section 8, but they may be in the middle of my list. The people on the bottom of the list are people in transitional housing. And they're also people who are first-time homeless. They don't have disabling conditions. Those folks are going to go out with rapid rehousing because we're going to just look at their money. We're just going to look at, they just need a little bit of money to get back on their feet. So you have to be careful with your by name list, and you have to use it in a way that's socially just and effective, and making sure that you're attaching the right housing. I want you to think about your resources in your community as a pizza pie, right? And then you have your universe of people on your by name list. I want you to think about it this way. Everybody on that list needs a slice of that pizza. Some people's slices are going to be smaller, and some people's slices are going to be really big. But you as a community are going to have to figure out how to divvy up those precious, limited slices of pizza. And that's how you kind of think about that. So that has been a very big piece for us, is managing that by name list. So even today, I meet every 2 weeks on Zoom with 40 providers, and we go over our by name list. The by name list is updated almost daily, because it reflects people being housed coming off. It reflects new people coming into our system going on. Now, how do people get on our by name list? It's really simple. You can either fill it out yourself and submit it to us, or you can call up our drop-in center. We do an interview with you, and then we generate a 2-page document, and we give you a score, and you sit on our housing prioritization list. And then when we have our calls where we do the matches, that's where we find out, is the person housing ready? Housing ready, remember, means they have ID. So if the case manager doesn't get that person that ID to be ready, we're going to jump over that person. We're not going to take them off the list. It just means we're not going to have the next person waiting in queue, sitting around for weeks. We used to do it that way. It's just a terrible way to work. Now we're like, and it teaches the case manager, be on your game, get your work done, get this person the documents. Otherwise, they're going to get jumped over, and we're going to go to the next person. So the by name list, which now we call the HPL, our housing prioritization list, that's what we call it, as part of our coordinated assessment process, which is actually documented and written out by our COC. And it says, these are our priority population. These are the scores that are given to people in these categories. And that's how we determine how housing is assigned. And it's not a perfect system, but it's something that you're always evolving. My job, though, is to keep people to have fidelity to the process, because lots of people like to try to do the backdoor deals. You guys know about the backdoor deals, the phone call to the housing authority. My father's the governor, my uncle is blah, blah. And then you've got somebody getting subsidies and screws it up. So we make everybody go through this one system.
Thank you. That was wonderful. I'm curious. First of all, real simple question. How many people right now do you have in your shelter?
So our shelter is actually closed. We closed our shelter. If you remember, during the pandemic, New York City was number one.
Mm-hmm.
And Bergen County was right behind it, because we're right outside of New York City. We got slammed. So most people don't know that's us, because it was New York and California, but then Bergen County snuck in there right behind New York City. So it was New York City and Jersey, but what they meant was my community. So I knew that was going to happen. I wrote a plan 6 weeks before. I wrote a plan in February, kind of seeing it coming. So I started to do what I would describe as like a homeless version of Schindler's List. I was like sneaking people out of the shelter. I was trying to reduce the census, like covertly, knowing that we were going to get to a point where I was going to have to shut it down. And we did get to that point. We had a staff member get ill with COVID in March, in April. She worked a shift. She was exposed to people. Luckily, she had a mask on. Our folks had masks. We jumped right on that. Nobody got sick from her, but she did die. And it was horrible. It was one of the Christchurch staff. And I put everybody in motels. Our folks are still in motels right now. We have about 70 people in motels. Our normal shelter capacity is 90. And what we've done with our shelter is we're redesigning it for social distancing. It has different signing. It has MERV filters. It's real state-of-the-art stuff and plexiglass. But to be honest with you, during a pandemic, there really is no real safe way to operate a congregate shelter. And this is just my opinion. So what we've been doing is we've had people in motels, and since we shut down in April, we have housed 81 households from the motels into permanent housing. So we didn't stop what we were doing. And the reason that's important to say that to you is because this is what I'm saying. You don't need my big fancy building to do this good work. It's great to have it. Don't get me wrong. It is. It's great to have it. But what Bergen County really does well is Bergen County does this collaboration, that all the people that all do the different parts of the homeless work together really well. And we have our by name list, and we're still matching people to housing. And that can be done virtually. It doesn't have to be in the shelter. And I think that's been the greatest test, is to say, wow, because people can look at Bergen and go, oh, of course they ended homelessness. They've got a lot of money. They got that big center, blah, blah, blah. But we're still doing it. We ended homelessness because we have housing, and because we prioritize that housing for the most vulnerable. We didn't have housing for everybody. We still don't have housing for everybody. But if you want to end homelessness in the way of thinking of not seeing people on the street, that's what we think about when we say ending homelessness. Your people on the street are your most challenging of your homeless folks. That's why they're on the street. So your efforts have to be directed at the most vulnerable. And that's what we've done. I would say the only thing I would say that I don't like about the motels is that the motels are not ideal for people that are being, I don't know if you guys are reading the news about all the people being released from prison into homelessness, not loving that. It's one thing if they're discharged to my shelter, I can handle them. But to put someone who just got paroled into a motel room that's unsupervised with prostitution around and drug deal, it's like we're setting them up to fail. So we're hoping to open up very soon. I think the county would like it to have been yesterday, but I would say, I think their target's probably the beginning of January to try to reopen. So what we've done now in the motels, we've already told people when the shelter opens up, if you're still homeless, you're coming in with us. We have other folks that were saying, when the shelter opens up, you're not coming in. So you better put a move on and get to housing now, because you've been in our shelter on and off for 6 years now. We're done with that. We need to help new people, because remember too, we're going to have new people coming into our system. The predictions are upwards of 45% of new homeless, of people losing their jobs, especially what's going on, because we've been dealing with it so long here. And, we have the second wave that's happening now, and businesses are still shuttered. So I'm really trying to focus on those new folks. So my message to these other folks are, get a move on. Let's get your rapid rehousing or temporary rental assistance or whatever we're doing, because this isn't going to be an option for you. We need to have beds open for the new rush of people that we're going to have to be dealing with.
Well, you answered my second question to that, by the way, and that was, how are you dealing with COVID? And you answered that.
Yeah.
So,
and I would say not one person that was in the shelter got COVID. Now, I don't love the motels. I think that they're, a little bit of a den of iniquity, but we kept people from getting COVID. So from that, it did work. It did serve its purpose. And we're very close to now to getting the vaccine. I think the vaccines are going to be really helpful. I think without the vaccine, I don't really think there's going to be a safe way, because think about it. You're going to have to be testing people like every other day. And that gets real monotonous and expensive. And our folks are the folks that will die if they get COVID. They have hypertension and diabetes, and they're overweight, and they have underlying conditions and things like that.
Yeah, absolutely.
So what's your next question, my friend?
Okay. Well, let's close with these two questions. Okay, we won't keep you too awful long, Julia. So the single biggest challenge from your experience, okay, the single biggest challenge for a city like ours to get started. So let me just say, our city is about 100,000 people. Our county is about 120,000 people. Okay. So we're very close to Kansas City, but we're our own entity out here. And we have every intention in the world of doing this. That ship has sailed. We're sold. Built for Zero is what we're going to get going here. So what's our biggest challenge? That's the first question. And then be thinking about what's the single most important ingredient or component that we need to be mindful of in meeting that challenge.
Okay. So let me start with the second question first, because I think that's a good lead in. So I always give this kind of visual way to think about what we've done. And when communities come to me and they want to, everybody comes to us with an idea of what they want to hear, or a part of what we've done that they're interested in. So I always say to people, when you come up to look at Bergen, you're looking at three things. So think about our facility as a car, as a race car, like this beautiful, shiny, really fast race car, right? Race car can't win a race by itself. It needs a really good driver. So I'm the driver. I'm the driver of this process. Now, in a car race, right? You have a good driver, you have a great car, you still need one more thing. You need a really good pit crew, right? So who's your pit crew? Your pit crew are all the organizations that provide the vital services. If you don't have one of those things, you're not going to win the race. And ending homelessness is the race. So when you're looking at your community and you're doing that self-assessment, what of these three elements are you lacking? Do you not have? It sounds to me like you're all in. It sounds like there's leadership there. Bergen County, most importantly, now, depends who you talk to, they would tell you different things. The government will tell you that the most important ingredient is political will. And they're absolutely right. Political will is huge. Because this facility and this process was the government. So when I do presentations, people are like, how'd you convince the government? I'm like, oh, no, this is the government and they hired me. And I'm able to do fabulous stuff because they support my fabulous stuff. I'm carrying out their vision. I'm not so sure they believed that their vision was going to happen. I think I surprised them. Because they didn't hire me and say, you need to go end homelessness. They were like, you need to go run this facility. I'm the one who said, we can end homelessness. Like, we're like right there. Like, let's do that. So that's what most people in our government would say is it's political will. And a lot of people would say, yeah, that's the number one thing. My housing authority that I work for would tell you it's housing. That if you don't have housing, you're not going to end homelessness. That's true, but housing isn't enough because you can give somebody a voucher. It doesn't mean they're going to lease up. It doesn't mean they're going to find something. You got to have that good case management. So I think from all these years of talking about what we do, I think ultimately it's leadership, because leadership will find a way. So if your government is saying, like, look at Opening Doors, which was Michelle Obama's initiative, which was the mayor's challenge. Veteran homelessness went down 50%. Why? Because when the government says we're going to end veteran homelessness and we're going to put money into it, you end veteran homelessness. Like, they did that. And we were one of the communities that we were able to do that. But what's interesting is that, in my opinion, ending chronic homelessness was far more superior of an accomplishment, but you wouldn't know it because everybody really looks at veterans, because veterans are good and worthy and deserving. And chronically homeless people is like this icky other thing we got to deal with. But I'm like, yeah, but it's the chronic homelessness that's ruining our cities. It's the chronic homelessness that people are upset about. It's chronic homelessness that is killing people. It's horrible. It's horrible on a multitude of specters. So when you look at leadership, leadership can move that. Leadership can find funding. Leadership can talk to power. So that leadership in this, when you say to me, you're all in, you're halfway there. To me, that's a community that's halfway there. If you've got somebody saying, oh no, we're going to do this. So like today, I'll say to you, I'm going to end all homelessness in Bergen County before I retire. That's what I'm going to do. I'm dead set on it. It's going to happen. Get out of my way, because I will just bulldoze you. And I need to do that. Because I can see it in my sights. When you tell me 100,000 people, that is a manageable number. We're a community of 1 million people, 1 million. And on our last point in time, we had 4 unsheltered homelessness. And I'm just like, why is no one doing a ticker tape parade for us? We had 4 unsheltered homelessness. And people like, and I'm just like, no, nothing, no applause, no, like, that's unheard of in a community of 1 million people, because we got in front of it, and you stay in front of it. See, that's the other thing. You can take a place like Salt Lake City. In fact, I think they just got an award on homelessness, but they ended homelessness, and they ended homelessness the same time we did on chronic, and we got no attention, and they did. It was very political, and they got a lot of attention at Salt Lake City, but you know what happened to them? Their numbers went back up, because homelessness is not, we're going to house 80 people or 800 people or 8,000 people or 80,000 people, and we're done. And then we can just get an award and we're done. Homelessness is about perfecting your system of response to homelessness that's ongoing. So what you guys are not looking at is not a one-time, how do we slam dunk these people and then we're done. What you're looking at is perfecting your crisis response system to homelessness, perfecting that system so that it will continue even after you've housed everybody. So like in my system, what happens now is we had a guy who was in the woods for 16 years. He came to dinner and lunch every day for a decade. A decade. He would come in. We had Hurricane Sandy. Do you want a place to stay? No, thank you. We had hurricanes and heat waves and snowstorms. Do you want a place to stay? No, thank you. It drove me crazy. It drove me crazy. I felt like he was the only guy I failed in my entire community. I felt like a sham. I was like, I ended homelessness, but this guy, I didn't get this one guy. But he never admitted he was homeless. This past winter, he showed up and he was sitting there doing an intake with an intern. And I don't know if any of you were Seinfeld fans, but I did like a Kramer and I like skid. I was so shocked to see him. And I said, are you applying for shelter? And he said, yes. And I said to the staff, just don't scare him. No sudden movements. Just get him into the shelter. Long story short, this guy, chronically homeless, top of our list. He has a mental illness. He's not going to take medication. He's not aggressive, but he's the guy that wears 800 coats in August in the North. You know what I'm saying? Like he's ill. We're not going to fix him. We're just going to house him. The pandemic happens, and I think, oh my gosh, he's going to go back to the woods because it was summertime. He's going to go back to the woods. We put him in a motel. We brought him food. He didn't have any documents. He was from Egypt. We're like, he had no family. We put him in a motel room. We're bringing him things. But anyway, we put him in a shelter plus care voucher. We get him in an apartment in Hackensack. The landlord and his wife are so welcoming. They bring him cleaning supplies. I'm like, oh my gosh, this is like a beautiful thing. Because that's the answer to your other question, was the challenge. A lot of times it's landlords. So here I have this landlord that's embracing this man that slept outside for 16 years in his own apartment. Within 2 months, he's diagnosed with stage 4 colorectal cancer. He ends up in the hospital. I get the phone call from the case manager, and he's terminal and he's dying. And that's why he came off the street. That's why he finally came in. He was in so much pain. And I said, listen, what does he want? Just tell me what he wants. I'll get it for him. What does he want? He says, the only thing he wants is to not be in so much pain. I said, then he needs hospice. He needs to get onto hospice. And we did that. We got him into hospice care. The case manager worked with him, and he died. And I did with our pastor that I talked to you guys about. I called him up. I said, would you do a Zoom memorial for this man? The pastor said yes. The pastor just lost his mom to COVID, and I just lost my brother to COVID. So it's very emotional. And this was our 16-year guy in the street who came in, and we did this memorial. And the landlord was on the memorial call. And I thought, wow, this is like amazing. So it's a sad ending, but it's a critical, really what it shows is that when I talk about being a kind of community that even when you end homelessness, when that person shows up in your community, and Community Solutions used to say that, what are you going to do when the chronic homeless person, I go, how does a chronic person show up in your community? You don't know who they are. Here's this guy. It happened to us. But what did we do? When he was ready, we responded. He got immediate shelter. We attached him to housing. We attached him to case management. We stayed with him and we worked with him. And he did not die a homeless man. He died a housed man. And we were able to help him on his terms. And that's the measure of a community. Is your community able to do that? When that person finally says, I don't want to be on the street anymore. I can't live like this anymore. I don't want to be in pain anymore. I don't want to freeze to death or burn in the summer. I want to come in. Can you respond to that and be able to do that for them? If you can say yes to that, then you've done your job. Then that's really where you need to be. And so I think for us is the biggest challenge is giving people something they want. People aren't going to come off the street unless you have something they want. They don't want dirty shelters. They don't want unsafe shelters. They don't want to be forced to take medication. They don't want, if they were going to do that, they wouldn't be on the street. The street is for people that the system's failed them. So the system has to change in terms of its response. And then I think the other biggest thing is really landlords, having relationships with landlords. And then when they're good like that, you got to make a really big deal about it. Like we're on this Zoom call going, oh my gosh, you're such an amazing human being. And this guy was like so overwhelmed, he was almost embarrassed. Like, I really didn't do anything. I'm like, yes, you did. Come on. Welcoming a person who hasn't lived in their own apartment for decades in this joyous way is lovely and just so meaningful. So I hope I answered your question about those two things. And I do think that you all know, all of you on this call, you know what you need to do. You know. It's just getting everybody else to understand what you understand. It's about inspiring people. It's about, if you look behind me on my back wall, the two letters on either side, well, the letter in the middle is Cory Booker. It's a big deal for me, I'm just saying. But on either side of that, one is for ending veteran homelessness and one is for ending chronic. When you get to go to the White House and be thanked by your country for the work that you've done, there's nothing like that. Like that feeling is just, you want people to understand that this is the right thing to do. It's the cost-effective thing to do. It's the thing that makes, I don't want to live in a community where I see people sleeping outside. I'm not okay with that. In fact, if I see a person outside, I literally pull over my car. I pull over my car with my friends, family, I don't care, in the car, get out of my car with my phone. Who are you? What do you need? Let me get you, because you can't sleep on the street. I'm like a police officer for a million people. Who is speaking for you? So the thing I would say to you is that if you would like me to, at another juncture, to have a conversation to speak to the powers that be, I'm happy to do that. I just did that for Tucson. I spoke to their mayor's office and they had a big event, and because I can be like, listen, I'm Jersey, but but this resonates. The stories that I can tell and the struggles that we have are the same. Our people are the same. The reason they're homeless are the same. The reason they don't want to be housed are the same. But we need to inspire people to take up the gauntlet, to say no more. If you're 120,000 people in your county, you don't have to take it to scale. You're not Los Angeles. That's a real problem. Like, that's like, I was out there last year in California. I cried what I saw. I cried how bad it was. Your problem is solvable. You can actually meet this need. You just need to make it doable, attainable, and you need to have champions in every little part. All the people in your arena, find your champions, those few people, and just work with those. Because you know what ends up happening is, as you get success, other people want to be at the party. I got news. They like success. They may not be there initially, but when they start seeing you house people and the numbers going up and the things changing, everybody's going to want to be at that party. So that's what I would say. And again, I'm happy to speak to another group, or, we can arrange that. It's the most favorite part of my job, is being able to talk about this, because when I was vetting for, this is the last thing I'll say, but when I was vetting for ending chronic homelessness, I was like a lunatic. I remember going to the national conference and finding the lanyards of the people who were reading my proposal and poking them in the chest, like, I'm like, confirm us. Why are you? Because they dragged us through the mud and they dragged us through the mud. And I finally said, why are you? It's taken 9 months. Why haven't you confirmed us as the first community in the country? And they said, Julia, we need to make sure it's not you. We need to make sure that if you're not there, that this work's going to continue. And you know what? I know that it will, because we've put in place the rule book to make sure. But I remember writing that out and thinking to myself, I want to be first, because I want to be able to inspire other communities that you can do this. We can end homelessness. It's not like a made up thing. It's actually a real thing. You can actually bring your numbers down and you can sustain it. And you can have an effective crisis solution for people that fall into, because it could happen to anyone, especially during the pandemic. Haven't we learned that? It can happen to anyone. So again, I extend that invitation to you. I'm always happy. If you can tolerate listening to me this long, I'm certainly happy to talk to other people about it.
Well, Julia, we can certainly tolerate it. That's for sure. And again, and you've done this through the course of this whole discussion. You've actually answered most of the questions that we had. We didn't even have to ask them. And that was going to be the last one. Would you be willing to make yourself available to us again, or perhaps another group of people, like you mentioned? And so we're thrilled that you are, and just so grateful, Julia.
Oh, you're welcome.
So grateful for
You're
sharing.
welcome.
Thank you.
You're welcome. And just like, really, you guys you're warriors. You just have to keep fighting and find other warriors. That's the most important thing, is we've got to like support each other. And I promise, if we do another one, you wait till you see my slides. I've got all kinds of very impressive stuff. I've been perfecting it while I've been home. It's been nice, because a lot of communities, they want to inspire other people to take up this charge. So John, you let me know if you want to do something else. I'm sorry I didn't get a chance to talk to the muted people who were very well behaved, but they're nodding. And I appreciate that when I'm talking, that you're all nodding, like giving me a thumbs up. And thank you for the chats and all the nice things. Let me just make sure I read all of them. So John, I just look forward to, a continued conversation.
Absolutely.
And maybe one of these days we'll all be able to see each other at a conference. Wouldn't that be nice?
I'd fly you out here personally.
I have always wanted to go to Kansas.
Absolutely.
I had a colleague that worked for me for years who was from Kansas. And I'm like, one of these days, I gotta go.
Yeah.
I've always wanted to. I'm out there in a heartbeat. Let's just get over this.
Okay,
Maybe the
bet.
springtime would be terrific.
it would be wonderful. Julia, thank you. God bless.
You're
Thank you so
welcome. You
much.
too. Bye, everybody.
Okay,
Bye.
bye.